Hi everyone, it's Dr. Gina Joe, or Dr. Gina Jefferson, Professor of Otolaryngology, Head and Neck Surgery. So, the topic of shadowing surgeons recently came up with my institution's Student National Medical Association president. The issue is that many students don't discover surgery or the surgical subspecialties until late in their medical school career. Even during your third year surgical clerkship, it is often difficult to gather exposure to surgical subspecialties such as otolaryngology because they're not offered as part of the electives. Well, shadowing opportunities that you create for yourself during your first and second year are critical to gaining additional understanding of a surgical field that you might be considering. So I have 3 tips for you. Tip number 1, this is a great time of year for you first and second year students to arrange a shadowing opportunity for yourself. The fourth year students who have just finished their acting internships as they begin their interview season. So that means you won't be crowding an operating room or really overburdening the residents. There are a few ways that you can arrange a shadowing experience. You can go through the residency program coordinator, for example, who also typically schedules medical students' activities. This is the more formal route and essentially establishes your relationship with the program coordinator who will schedule your acting internship, perhaps help you identify someone with whom you can do research, as well as the person whom will schedule your future interview. If your school has an ENT interest group, the faculty advisor for that interest group might be the person with whom you can schedule a shadowing opportunity. And quite frankly, you can often just ask a resident if you can shadow or step into an operating room when you have the available time. The resident, of course, will notify the attending that you will be present. Tip number 2, the shadowing experience is an amazing opportunity for you to not only see the amazing work that occurs in the operating room, but also to engage the residents and attending responsible for that particular case. It's your opportunity to really ask the questions as to why it is we chose a field of otolaryngology, what it is that we love most about our specialty, plus so much more. I'd also recommend doing a little case preparation prior to your shadowing opportunity, if possible. It will allow you to have more knowledge about that particular case so that you can ask appropriate questions. Attendings and residents alike are more receptive to those who are prepared and more likely to go out of our way to show you important anatomical landmarks, what it is specifically that we are doing during that case. And that will make the experience even more impressive for you to truly understand why it is we went into otolaryngology. Tip number 3, take advantage of everyone you meet during your shadowing experience. If ENT becomes your field of choice, establishing early relationships is critical for you to gain productive research experiences. This is why shadowing as an M1 during this time of year is so important. It enables you to begin the undertaking of research opportunities to really build your CV so that your research experiences become productive of publications and oral presentations. Also, the resident connections that you make during shadowing allows you a resource for questions as they arise during your pathway towards securing an otolaryngology residency. This time of year for shadowing opportunities as an M2 is also important as it will help you decide whether or not you want to go ahead and arrange an elective during your third year. I hope that these tips have highlighted some of the benefits of shadowing opportunities as an early medical student. If you find my tips helpful, share them with your friends and continue to follow me at Dr. Gina Joe on Instagram, YouTube, and Twitter.